One of the big challenges of prolonged spaceflight is weakened muscles, but it's just as big a risk and challenge for those of us on Earth who are injured or confined to bed. In today's episode, we'll take a look at the timeline for muscle loss with bed rest for both size and strength, what it might mean for rehab, and also the concept of prehabilitation. We are used to seeing videos of astronauts effortlessly floating in space. While this can be great fun, the lack of gravity means that our muscles are not having to work to hold us upright. One thing the body is extremely good at is adapting to the stress or lack of stress that it experiences. So when we are in space, both the muscle and bone adapts by getting less strong. This is especially true in the postural muscles of our lower body and lower back. If this is allowed to continue, this may mean that astronauts can no longer function properly, especially in emergencies. It can also cause serious weakness and risk of fractures when back on Earth. To counter this, astronauts perform 60 to 90 minutes of exercise every day. It might also take protein or calcium supplements. One way to study microgravity on Earth is through prolonged bed rest, where the body also does not have to support its own weight for days to months at a time. Marusic and colleagues in 2021 reviewed the existing bed rest literature to answer the following questions. 1. How much does muscle strength and size decrease over prolonged bed rest? And 2. Does the rate of decrease change over time? To do this, 40 studies were analyzed, lasting from 5 to 120 days of bed rest. In total, data from 318 20 to 37-year-olds were used, including 41 women. Studies had either horizontal bed rest, or else bed rest where the head was angled down by 6 degrees to replicate the fluid shifts that happen in space when gravity isn't drawing blood down to our legs. Specifically, data on the strength and size changes of the knee extensors or thigh muscles were studied. This graph shows how many days of bed rest on the horizontal axis and the relative change in size and strength on the vertical axis. Both size and strength featured a fast initial decrease over the first few days or weeks of bed rest. This rate of decrease then slowed down over months of bed rest, maxing out at about 18% decrease in size and 30% decrease in strength after 120 days. The other interesting finding was the difference in amount of decrease between size and strength, with about a twofold greater decrease in strength compared to size. One explanation for this difference is that size alone does not tell us about muscle quality, which can refer to many cellular, hormonal, and also neural control mechanisms that change with bed rest. What can this information on the rate and amount of muscle weakening be used for? One obvious use is for astronaut mission planning. For example, planners can estimate the amount of strength loss over a Moon or Mars mission, design mission expectations around this, and also plan exercise and other ways to minimize this decrease. But for us here on Earth, I think bed rest and muscle atrophy studies really highlight the importance of aggressive rehab whenever possible following injury, rather than having patients immobile for extended periods. This goes beyond broken bones to recovery from cardiac surgery to even cancer treatment. Without aggressive rehab, even fairly short periods of immobilization can cause muscle weakening that becomes very hard to recover from later, especially as we get older. I think it also highlights the idea of prehab, where you build yourself up to be as strong as possible before facing a period of immobilization, such as surgery. This in turn can hasten your recovery by giving you a stronger baseline to start with. I hope that this video moves you to get stronger to get ready for all that life throws at you. I'm Professor Stephen Chung, and I run the Environmental Ergonomics Lab in the Department of Kinesiology at Brock University in Canada. We post new videos on different topics in environmental physiology every Wednesday. Thanks for watching, We'll see you next time.